This is part of a series on avoiding old-fashioned dentistry. Although the tooth is the hardest part of the body, it still flexes under our tremendous biting and chewing forces. Rigid and inflexible, this filling, a piece of amalgam, slowly rocked loose and separated from the surrounding tooth. This is a broken filling. Traditionally, this would be repaired with a crown, but this option reduces and weakens what is left of the natural tooth. A modern alternative is to place a conservative filling using the light-activated adhesive bonding technique. The tooth-colored filling sticks to the tooth, so only minimal drilling is required, and the risk of causing subsequent root canal is dramatically reduced.
Medical Watch report, there are revolutionary changes taking place in dentistry that are not only saving Americans money, but saving our teeth as well. Broken teeth are being mended with the use of space-age plastics instead of porcelain caps or crowns. The process, called bonding.
My mother, 30 years ago, read an article on Dr. Larrick and his bonding, his now 30-year bonding.
Our new techniques were the beginnings of 21st century dentistry. And back then,
I didn't have any idea, and when you mentioned the bonding, which at that time, I don't know of any other person doing any bonding work, particularly illicit, to the extent that you did for me. And you were definitely a pioneer in the bonding in 1983 when you did my work.
well, thank you. And again, to say, that's the real smile 25 years later. Big smile, very nice. Okay. Actually, the numbers of our telephone spell area code FLA Dr. Smile, our phone number. And it's not just that I limited my new approach to then revolutionary bonding. I believe in bonding, conservative dentistry, no metals.
I went to another dentist, and she did some dental work on the bottom left, and then she just moved right to the top right and put metal in a tooth, and I told her I didn't want any metal in my teeth, and said, well, it's not going to show because we're going to put a crown. Told her I didn't want any metal.
And saying that it's not going to show because it's under a crown, it's still in your body.
Exactly.
And I'm amazed. Patients are finding out more and more they don't want metal in their mouth. I used conservative alternatives and modern technology. And as an alternative to the invasive drill, we use gentle air abrasion to help avoid root canals.
Looking in the yellow pages, and you were the only one that had non-drilling technique.
Very good. And what did we do? We used that air abrasion?
Yeah, it worked great. No pain, no nothing.
No, we didn't have to give you any anesthesia?
None at all.
And then we did the bonding. What did it take, about 5 minutes?
That's about right.
More on closer to 4, but okay. And how's it feel? Bite?
Feels good.
All right, so that's simple, and that's called modern dentistry, and that's the most important thing, is having an informed patient who's educated, looking at the tooth half full rather than half empty. So let's take a look at some other patients and see how you can change the predictable outcome of predictable old-fashioned dentistry. Insurance had changed in something,
Yes.
and you went to some other dentist who told you what?
Basically, the same thing that every other dentist I've been to has told me, that the very difficult and expensive procedures are the first thing they recommend.
I talked to one doctor, and they wanted to do a root canal and a crown, and of course, very expensive. And I decided to get a second opinion. You looked at it and says, we can fix it a lot less. I think I've got like $350 in it.
And that's with bonding.
Yes.
And that was years ago, so
Yes.
I think we're not going to need a root canal.
No.
Last dentist,
Told me I needed a root canal right after I had a initial cleaning. 2 root canals actually, and 3 crowns.
and trying to avoid root canals. And one of those teeth, I saw you for the last visit, and what did I do?
He filed it off so my bite would be correct and no more headaches about worrying about a root canal. 0 after.
I went to 3 different dentists. All of them recommended a very complicated, expensive procedure.
Was it crowns?
It was crowns, root canal and a crown, as a matter of fact, yes. And then it was in 2000, and I came here to Dr. Larrick's, and he said I can do this in a more down-to-earth way, And that tooth is held for 8 years without a problem.
Well, thank you. That means we're in 2008, and you're a happy guy. It's a bonding that came out, but you admit to biting something hard, huh?
Yes.
So the beauty of bonding, it's very easy to repair, and we'll just put it back, and we're still friends. And by having an educated patient, they know that there's no problem. Because this is so easy to do, I'm just going to use some air abrasion and dust that tooth off like that. Was that easy? Okay, no needles, no nothing. We're going to clean it up and etch it and bond. About 5 minutes?
5 minutes.
Okay, and I appreciate what you said about down to earth. We call that conservative dentistry. The most important ingredient in modern dentistry is thinking and discretion. Any dentist can be quick to drill, but you want to be conservative. You want to save as much of that tooth as possible, so if there's a problem 10 years from now, then there's something of the tooth left that we can do a crown. If you keep whittling the tooth down, you end up with nothing.
Yeah, I've always felt, and I've always asked my dentist, if you keep on taking away from the tooth, there will be a problem at some point.
And I've been doing that since 1976, using adhesive dentistry to stick to the tooth and not try to take away healthy tooth structure.
Well, the thing is, I had a dentist who I just wanted a new filling, and he told me I need a root canal treatment and a crown.
Really?
So I didn't believe that. I figured it's really just a filling because I had lost my filling.
And what we do?
Did the sedative filling first,
We went slow, we put a temporary in.
calm the tooth down, and then you put the filling in. The filling is fantastic.
Thank you. A sedative temporary was first placed in the tooth to calm the tooth down. At a subsequent visit, it was removed, and light-activated bonding was affixed to the tooth, with no additional drilling, and the breakage was contained, treating only that part of the tooth that was necessary and leaving the tooth intact. And that's an informed patient. Patients are catching on. She just knew that the tooth didn't need a root canal and a crown. Thank you.
Thank you.
My crown fell out because there wasn't, I guess, a lot left up in there. I went to just a dentist that lived, in my area. Well, lo and behold, several months later, I get a bad infection because I was in excruciating pain.
At the root canal.
Well, because I'm a big chicken and I was in extreme amount of pain, I ended up having the tooth pulled.
All these teeth are crowned. The only tooth you can't see is this one that's had a crown and a root canal. No longer there. Here you can see on the x-ray the metal of the crowns covering the teeth. The only tooth that's not there that's one that had the root canal was extracted. Doesn't matter whether you get the root canal before the crown or after the crown. The results can be the same. We're talking about the molar life cycle, and there are 3 catalysts which power that step by step, and you mentioned them. One is fear, another is pain, and the third is a necessary catalyst is the dentist, who cooperates and contributes to your thinking that is negative.
Yeah.
You want a dentist who's optimistic and who can repair a tooth in a conservative way. If someone does a root canal and they haven't adjusted your bite first to see if it's not caused by chewing and grinding, then you may get a misdiagnosis. All these, it's very difficult to explain on a tape for everybody.
When the one in front of it started hurting, he wanted to do another root canal.
I adjusted your bite. How does it feel?
Feels good.
All right. I'd say at least half, if not more, of the problems I see are with bite problems. That's called occlusal disease, problems with an uneven bite, where they're banging on one tooth and that tooth gets sore. That can be misinterpreted as needing a root canal when all you have to do is adjust the bite. And that's how to avoid overtreatment.
After he looked at my bite and filed it down a few times, no more problems. 0.
Very good.
I'm happy. I'm here again.
Very good. And we'll be able to put a little bonding on that tooth and save you from a crown. If a tooth is sore, do you ever have any toothaches on some of these teeth? And your bite is uneven, and so you're grinding on these uneven teeth. Now, that's not a germ toothache. That's called trauma from occlusion. That's a bite toothache. Now, many times people who have an uneven bite expect the worst, and so does the dentist. This is where the dentist participates. And because the patient is suffering and they're in pain, and he makes a misdiagnosis and says you need a root canal. You get the root canal, the nerve's taken out of the tooth. Now you don't feel it anymore, but the bite is still uneven.
I had a root canal done on the lower back teeth. And 6 months after the root canal, they had to go in and pull the tooth.
I went to the dentist office for my first initial checkup, hoping for cleaning and to get my tooth fixed, and they told me I needed a root canal.
Everybody's worried about the future toothache.
Yes, I wanted to go on vacation and eat. I was hoping just to get a temporary filling at that point in time, and they refused me. So I called around and luckily got your office, and they said that they would do a free second opinion and got me in for an emergency checkup, and within the hour of me being here, you guys told me I didn't need any of that, and I got my temporary and my teeth cleaned.
And the tooth hasn't bothered you since?
No, it hasn't.
And unless you have a swelling or a sign on the x-ray, for sure that you need a root canal. It's a gray area. You need someone who's positive. Often patients, in fear, they avoid the dentist, and in fear they expect the worst possible procedure. So when the dentist says you need a root canal, they say okay. Another thing with pain, if there's crisis dentistry and the tooth is bothering them, then they're seeking for the instant solution, and they also agree to a root canal.
I think what happened is it broke.
Right. It was really a little sensitive.
Yes.
Differentiate between sensitivity and true toothache. Your tooth was what, just sensitive?
Yeah, it was sensitive.
Because part of the tooth was broken off. Sometimes the tooth can break off from breakage, being weakened by a previous metal filling, or sometimes it can break off because there's decay underneath, and that's a big difference. Avoid diagnosis based without x-rays, where a dentist just looks at your teeth and says, you need a root canal. That's why we go through an education program like that, explaining when we adjust the bite and when we do conservative bonding, that less is best. You try that first. And here we are with the finished case. Big smile.
Dentists are still replacing teeth, but with implants and no metal nylon appliances, things have changed.
Here's the before, and here's the after. That's a nylon partial we're putting in. Big smile.